The empty sagging breast is the classic lady who comes along to you, usually post-babies or post-weight loss. And there's some big questions to answer with the empty sagging breast. First of all, is the patient happy with their volume? The patient's happy with their volume and the breast is sagging, and we need to do a breast lift. So we can lift that breast up, bring it back up in a more youthful, rejuvenated position and shape by resuturing gland and getting rid of excess skin, but leaving with the same volume essentially, just removing skin, but they stay with the same volume, but the breast is lifted to more useful shape. If they're lacking volume and they're a bit saggy, it's possible under certain circumstances that we can use a prosthesis to fill up that envelope and fill out the emptiness. Obviously we need to use a prosthesis of appropriate size, and it'll get to a point where there's so much excess envelope or skin that the prosthesis would have to be ridiculously big to fill that up, or a size that's intolerable to the patient. So when you get to that circumstance, you need to do both lift the breast with surgery and use scars on the breast to do that, and use a breast augmentation as well, a breast prosthesis, to add the extra volume to the breast to get the desired result. So this all goes around, the key to this, assessing this problem, is to figure out which of those the patient fits into. Obviously there's different, again, patients have individual desires about the shape they really want, or they're prepared to tolerate, or etc. But this is basically the essence of assessing the empty saggy breast. It's recognised with this surgery that in certain circumstances this is a medical procedure. Certainly, but there's very strict criteria to be met by Medicare. Basically, if your youngest child is between 1 and 7 years of age and your nipple is below the inframammary fold, then there are Medicare items applicable. Unfortunately, if you fall outside those criteria, they're not Medicare items applicable. But certainly, you know, that group of people, then there are Medicare items that can very significantly decrease the potential costs of the surgery. It's usually surgery which is day surgery. It's usually tolerated very well. The recovery is usually quick and good. There's not a large functional downtime associated with the surgery. But with all surgery we do, this is really a matter of individual assessment of the patient, both of their physical characteristics and the personal desires of the patient and what they're trying to achieve.